First, I'd like to say thank you for everybody being here and inviting me on behalf of the entire EB community to have a chance to share with you my story, our story, and to learn from you through these 2 days. As I watched the doctors hold my newborn daughter Bella above my wife's tummy, they uncurled a skinless appendage that more resembled a chicken's wing than a baby's leg. Her skin was literally falling off her hips and her armpits from where the doctors had reached in and grabbed her, and she had holes in her left buttock from where the doc had gripped her with his latex glove to pull her out of my wife's body. This was my introduction to epidermolysis bullosa. Almost immediately, my wife and I tried to learn about every possible treatment for EB, including a new stem cell therapy that was taking place at 2 centers in the United States. The treatment was still in its infancy, so we thought we should wait for the docs to get it right before getting involved. 4 months later, I walked into Bella's latest hospital room, and I saw a little girl that looked halfway to heaven. A mystery infection almost took Bella from us that weekend, and we thought, if we wait around for these docs to get it right, and Bella dies along the way, we'll never forgive ourselves. So after traveling across the country to both centers to learn what we could, we made our choice. Our doctors and nurses couldn't have been more disclosing and compassionate. During our consultation and workup, we were given ample training, education, information, and support. And despite all the potential side effects, the risks, and the dangers, I also knew Bella was as good a candidate for transplant as anybody. She had an HLA-matched big sister. She was as healthy as an ox. She was free of any of the infections or deformities which are part and parcel of this disease. Transplant really seemed like the best option, since the other option was to watch her to continue to tear her skin and blister trying to do simple things. Watch each one of her nails tear off her hands and feet whenever I tried to clip them. Watch her hands and feet slowly fuse into stumps. Watch her undergo repeated esophageal dilatations as her throat shrank from constant blistering and scarring, just from eating. And watch her try to keep a smile on her face, despite being covered in gaping wounds that would heal less and less over time, and likely turn into an aggressive squamous cell carcinoma should she be lucky or unlucky enough to reach her 20s. With EB, time is not on your side. EB attacks on day 1, and it never takes a day off until it eventually kills its prey. The damage from this disease is brutally and relentlessly accumulates. It leaves debilitating scars and chronically infected wounds. And with almost no warning, kids with EB die. We had already had one near miss. Our choices were limited but clear. Watch our child slowly die from the worst disease we've never heard of. Or do something that we could to give her a chance for something better. As a parent, you make the best decisions you can for your children with all the information you can get. This was the right course for us. But things did not go as well as we had all hoped. Sadly, Bella died from complications related to the treatment itself on day plus 101 this past October. However, her autopsy showed that donor cells were finding their way to her skin and the lining of her mouth and throat. It was working. From what I understand, this is the first demonstration that stem cells from one organ can heal another tissue or organ. This is the one hope for a systemic cure for this horrendous disease. We knew we were in the dark ages of BMT for EB. So, this is Bella's legacy. Our baby girl will ultimately help all the other kids with EB behind her. Our hope is that 10 years from now, EB will be treatable because of research being done by all of you and courage from parents like us who refuse to give up and who are willing to put our child's life on the line to find a cure. What would you do if you knew time was running out for your child? How many other parents must sit on the sidelines afraid to seek treatment because doctors on the verge of a cure have to spend much of their time rewriting research designs and searching for research dollars? If you ask a parent, a doctor's purpose is to heal, not raise money. As the director of one of the 4 EB foundations in the United States, who do what we can to fill the gap, I speak for all of them today when I tell you we cannot do this alone. I challenge you to empower these researchers with the funding and clearance they need. Without their vision and courage to take on previously incurable diseases, do you know what progress is going to be made? None. Don't let this be your legacy. History doesn't remember the ones who played it safe. We risked our daughter's life, and I promise you, she is remembered. By the boy who just went home early from his EBDMT, she is remembered. By the 20,000 hits a month on her blog still to this day, she is remembered. By the 1,100 guests who attended Bella's memorials over the internet, live via webcast, from every time zone on this planet, she is remembered. And now by you, a cohort of pioneers who are rewriting history with your work, one child at a time. She is remembered. Thank you.